Yes.
And we are live.
We're live. Deepshikha, are you able to change your phone the other way? Because we seeing you in the opposite direction, like vertical instead of horizontal.
Okay, let me try.
I'll begin anyway because we are live now. So happy new year, happy new beginnings, happy new better to our global citizens, and welcome to our first episode of Global Youth Mental Health Awareness Show of 2021, where we have conversations with the youth about mental health. I'm your host, Katinda Ndola, author of The Big Comeback and the founder of the Confidence and Self-Esteem Academy. And in today's show, we are so blessed to be in the presence of three amazing panelists. And the panelists have been on the show before. So some of you who are watching today might know some of the panelists today. Our first panelist is Edwin Gitau. Edwin is a certified addiction psychologist, founding director at Tuhai Center, and a global goodwill ambassador. Hello and welcome to the show, Edwin.
Hello, Katinda. Happy New Year. Happy New Year, everybody. Welcome to the show.
Thank you. And our second panelist is Preeti, Pasricha. She's the founder and CEO at EYES, which is Enlighten Yourself Every Session. Hello and welcome to the show, Preeti.
Thank you for the warm welcome, Katinda. Thank you.
You're welcome. And the third panelist is Deepshikha Tripathi. Deepshikha is a counselor, a life coach, and a founder at the Prayers Trust and project director of Poo Patham. Hello and welcome to the show, Deepshikha.
Hello, everyone. Good day. Good evening.
Okay. Now, today, in our conversation today, you're going to be sharing some insights on the management of addiction and stages of progression. Now, before we start the conversation, I'd like to ask, how are we feeling today?
I always feel better. I am good every day and every moment. I just take everything so positively and optimistically that whatever happens, I am happy every day. So I'm happy even now.
That's fabulous. What about you, Edwin? How are you feeling today?
Thank you very much. This has been a long break, so I was so anxious. I'm so excited, and being the new year, and I believe we are going to benefit. We are going to share. So I'm super excited. I'm feeling fully anxious on the program for today. Thank you, Katinda.
What about Deepshikha? How are you feeling today?
Amazing. I'm feeling amazing.
Fabulous. Now,
to be on the show, yeah.
Yes. So last year on the Global
to be
Youth.
On the show.
Sorry, go ahead. Okay. So last year on the Global Youth Mental Health Awareness Show, we talked about addiction and we defined what addiction is and how addiction impacts us, our families, and communities in general as well, and how to seek for help as well. So today we're going to be diving deeper with this conversation about addiction, because it looks like this is a very important topic that affects a lot of people in the family communities as well. And the first question is, what are the identifiable stages of addiction? Edwin.
Thank you very much, Katinda. It can be a very good beginning to start by asking ourselves what is addiction, and like we mentioned there before, that addiction is any condition whereby you're not able to control yourself, be it when we classify them into two. There is a behavioral addiction and the chemical addiction. And there are stages, although it's a very gradual process for you to be full-blown an addict or a person with substance use disorder. There are stages which are identifiable. They are indicators that we should always look out for. And because not everybody who takes alcohol, not everybody who can be classified as an addict. So what are the stages? What are the indicators? What are the identifiable signals or symptoms that can lead us to that direction to classify you as a person in addiction. And there are stages that normally take place, although they are very gradual. In most cases, very rarely will we notice when these things are happening. And this is very important to begin the year with, because in a few days back, we had long holidays, we had the Christmas, we had the long break from COVID, and there are people who could have engaged in these habits, and they really want to know, could I be addicted? Could I be having a problem? So to begin with, the first initial stage is the experimental stage, and this normally happens mostly in our families, where the young ones, they tend to copy, or rather they want to emulate what the elders are doing. They want to practice, to put in practice what they've seen their seniors or the elders doing. So the first stage is experimental, and this is out of curiosity. This is out of something that they have seen. Remember, nobody can just wake up one morning, Katinda, and start injecting drugs. There is a sequence of events that normally happens. So the very first stage is the experimental stage, viewing and seeing other people do, and you try to copy what they are doing. That is step number one. Step number two is usually the social way of taking alcohol or abusing substances, or the behaviors. You do it socially because it's something that is culturally acceptable. Here in Kenya, there are so many activities that cannot go on without consumption of alcohol. It's a cleansing. It's culturally accepted, rather. So it's a way of celebrating. I normally say that alcohol is a social drink, but at the same time, it is a gateway. It is a gateway to other hard stuff, other big problems, because it opens, or rather it opens the gate to other substances. So socially, when you see it's being done socially, you'll drink it for social affairs. You just want to feel free with your friends, and there is nothing much. But now you've gone the second stage. The first was to experiment. Now you're using socially in your family, eat with your cousins, with your relatives, at your workplace. When you're having end of year party, alcohol is part of it. So it's a social thing. Then gradually it becomes a habit. Now that it has been introduced, remember we normally say that addiction is a disease. It is a brain disease, because these are chemicals, and these chemicals, they normally change the way our brains function. So it becomes a habit. You want to do it again today, you want to do it in the evening, the day after, so it becomes a habit. Slowly it becomes something that if you want to boost your courage, if you want to boost your esteem when you have low self-esteem, you use it as an instrument to help you accumulate or acquire courage or the esteem. Say, for example, I'm shy to talk to somebody. Say, for example, I'm going for an interview and I'm feeling like, wow, I'm stressed up. So to relieve my tension, I go and have a puff of marijuana. And this way, you're using it as an instrument. You're using it as something to boost for those people who don't have proper self-esteem. So this is the fourth stage. And then finally, the compulsive stage, whereby you must use it for your body to function. You must use it for you to feel comfortable. You must use it, whereby you find people, they are taking, despite the fact that this thing is having repercussions, it's having some negative effects to them. But they have to do it to calm their nerves. They have to do it to be comfortable. And this is the stage now that we call addiction. Thank you, Katinda.
Thank you. Thank you so much. That's a lot of information to take in there. Yes. So what about Preeti and Deepshikha? What are your thoughts? What are some identifiable stages of addiction? What are some of your thoughts?
Yes, Katinda, according to me, but then yes, thank you, Edwin. This was really a quite insightful information. I would actually, you have already spoken a lot about it. I will just take it ahead from there. So for me to identify what are the stages, I guess first we need to know that addiction is one of the most common mental illness. Most of the times people think that they are not addicted to anything and this is just a regular thing. So first of all, this needs to be known by them that they are into addiction. Now again, it is important to know that the cycle of addiction and its stages so that once you are aware that you are addicted, only then the medical professionals and your family members or friends can intervene, isn't it? Unless you accept and your family members know that. So then vulnerability to addiction, it actually also differs from person to person and is impacted by both environmental and genetic factors. Now, how do we identify whether the person is addicted or not? There are certain signs given by them that most of the times there is a loss of control, or they abandon certain hobbies and activities. And also there is poor performance at school or at colleges or at work. And then there are unexplained financial problems. And Mr. Edwin has already explained us about the stages. So I will just mention about how these stages start. So these stages start with regular use. First of all, it actually starts with a regular use where people become regular users, and then they take only it on weekends, or maybe when they are spending time with friends, or maybe when they are just individuals, and then they start showing certain signs of addiction. And secondly, after this regular use comes the risky use. This is when the use of the addiction deepens. The people may actually begin to exhibit dangerous behavior, such as driving while drunk or when they are high, and the substance in question may actually impact one's ability to succeed at work or school. Now, once they become the regular users, they get towards the risky users, and then slowly the dependence on the drugs increases. So at this stage, the individual has actually developed a tolerance to the subject and needs a dangerous amount of it to feel good again. And then when he comes on the dependence on addiction, and then comes the addiction actually seeps in where they cannot live without these drugs. So then these should be prevented, as they say, nip it in the bud. So as soon as you identify, they should be given help, and medical professionals, their family members should intervene to offer help. Thank you, Katinda. Thanks,
Thank
Katinda.
you. That was very insightful as well. So, Deepshikha, what would you like to add to that?
Now, I have this privilege of speaking at last, so I'll just utilize it full on. Okay. So, the very first step is awareness, like the victim in itself. So, in themselves, they must be aware that I'm having this problem. And then, after that, the second step is acceptance. Once one person get aware and accept his situation, then he can do anything about that. As well, his surrounding or his emotional support system can do anything about that person. So from my side, there's acceptance and awareness are prime for just going ahead with the process of treatment, okay, and getting better. And when it comes to stages, I would say, yeah, first, usually one try out of curiosity. I'm just simplifying the stages, not going much into that. So the very first thing is that once try it out of curiosity, and then some of like enthusiasm and peer pressure is also there among teenagers, especially, and adolescents. And then comes our circle in adults. If like in our friend circle, most of persons used to do that, then automatically it gears up, and then we think, oh, there's no harm in trying it. And sometimes, until and unless you are rational about using a substance, it's okay. It can be fine with you as well, with your life and your loved ones. But the moment it just takes a toll of you, then problem arises. So that's something which needs to be noticed and taken care of. Just that was from my side.
Thank you. Thank you. Now, moving on to the next
Thank
question,
you.
which looks like it's more detailed here, but let's keep it short because of the time factor. So, what are the initial steps in management of alcohol and drug abuse at the prevention stage? So, what do you think? So, the prevention stage, what are the steps that people need to take?
Yes, I guess who is Mr. Edwin will be speaking.
No, go for it, because we're trying to really get it quick because we've got like 4 points in that section which we need to go through very quickly.
Okay, so you asked about how to prevent the drugs. What did you ask about?
Yeah. So, what are the initial steps in management of alcohol and drug abuse at the prevention stage?
Okay, perfect. So, according to me, I guess one of the most effective ways to prevent drug abuse is to get professional help for a mental illness. Now, how can this be done is through meditation and talk therapy. People with mental illness can actually get symptom free, and also they can improve their life in countless ways. Now for this, first of all, they need to be admitting this, that they are powerless over the addiction. They don't have actually any control over their addiction. They also need to admit that addiction is a disease, and that actually disrupts the brain chemistry and the circuitry, which in turn impacts the willpower, the rewards, the memory, and motivation. So then, after this, they need to be taking a moral inventory of themselves. Now, how will they do this? Is that the inventory of self is meant to be comprehensive, searching, and fearless. Now, again, I will just name the different stages how they can prevent this. First of all, there should be treatment initiation that should be taken by the person who is taking drugs, and then secondly, early abstinence, thirdly, maintaining that abstinence, and then fourth, advanced recovery. If all these stages are followed, if medical help is being given from the beginning itself, I guess any person can come out of this.
Thank you.
Thank you,
Thank you.
Katinda.
Edwin, what are your thoughts on that? What are some
Thank
steps?
you. Thank you very much. You talked about the prevention stage, and I would begin by saying there is something that Deepshikha mentioned, that awareness creation is the most
Hmm.
important stage. You create awareness. Whatever we are doing right now, Katinda, we are creating awareness on the dangers of abusing substances, chemicals, and substances. So this is the very initial stage that for those who have already indulged, to stop it or to look for help. For those who have not started, for those who have not initiated, they should stop, because it begins with a very fast drink, begins with a very fast puff, it begins with a very fast, the initial one, that is the one that triggers. So creating awareness and sensitizing the communities, our family members, and the public at large, create awareness. I always like mentioning that I take it as my responsibility to prevent. When I share information, evidence based information, scientifically proven information, that for sure, if you start with the initial drink, you could be landing yourself in problems, being unable to control it later in life. So, the primary prevention steps is creating awareness, sensitizing, and for those who have already indulged into it, they do it and do it responsibly. And if there is need, they should seek for professional help. That is the very, actually, scientifically, we've been told that we call it demand reduction. We try to enlighten our people so that they don't desire, they don't have that curiosity, so such that even when it is supplied, it is on your doorstep, you cannot partake of it because you know the consequences. So initial one is awareness. Then from there, we deal to the next level when it becomes beyond prevention. That means you've already indulged in it. Then it escalates to the next level, which is treatment, and we are coming there.
Yes,
Thank
that's
you.
right. Right.
Right.
Deepshikha, did you have anything to add to that?
Yeah, I would say the first very step is screening. Once one is screened that some substance is there, presence of some substance is there, then further we can go ahead. And most important, as I have mentioned, it's very important to just take care of that, because some kind of, if we are going to just observe this in minutely, then we will find that some kind of association or some kind of generalization is there with such kind of habits. So once if we just get down the root cause of that, then that will be very helpful in diagnosing as well, just getting ahead with the treatment in the best possible way.
Okay, so
That
moving
was from
forward,
my side.
yeah, so the next stage is the treatment. So what?
Association. Sorry.
Okay, so the next stage is the question was, what are the initial steps in management of alcohol and drug abuse at the treatment stage?
So, shall I start? Yeah, Mr. Edwin, please you go ahead.
Okay. Thank you, Preeti. I'll start by saying that once you've already passed, you already passed the prevention. Once somebody has already now been introduced, once you have experimented, and it becomes difficult for you to quit. It becomes difficult for you to abstain from the substances. Then this is the stage that we call for treatment. This is where we look for professional help. And I would want to mention that we have so many people out there who are pretending to be professionals, but they are not professionals. Look for accredited persons within your institutions or in the ones that have been accredited by your government, because we have so many courts. Now, at the treatment stage, the very initial step, the most important step is screening and assessment. When somebody has already passed the stage of prevention, you cannot prevent, he has already indulged, and he comes to my desk as a professional, I'll first do a screening, I'll do an assessment to see the extent, to tell the damage, how far this person has been in substances, and what is the level of addiction. Is this person having co-occurring disorders? Does this person have mental issues? Does this person need medical attention? Does this person need to see a psychiatrist? Once you do the screening, once you do the assessment, from that stage, that's where now you can plan the treatment for this person, because addiction involves so many faculties. There are issues at home, social issues. There are health issues within the person, physical issues. There are mental issues, whereby this person could be having a mental disorder that is co-occurring, is having a pre-existing condition. So all these will be picked from the assessment and screening, from the screening and assessment stage. Then subsequently, we'll start with the treatment. And in this treatment, there are several stages, and I know with time, Katinda, you will give me time to address on that. Thank you, Katinda.
Okay, so just moving forward, because in the interest of time, I'll just get you, Preeti and Deepshikha, just add on to what Edwin is saying, or just add on to it, because we have a few more questions before time is up.
Yes,
So,
sure. I will just add on to what Mr. Edwin said. Thank you, Katinda. Yes, you rightly said that the person needs to come for the professional help. So I would say the person needs to take the initiation first, that he needs to be treated. That person should be aware that treatment is required. So first stage is treatment initiation, as I also said in my earlier question. But then most of the times, what happens is, in the earlier days, people actually feel that giving up the drug is not a good choice. It will not work for them permanently. So then they first of all don't accept whether should they give up with the drugs or not. So this treatment initiation, the first stage, should be taken consideration into looking at the damaging effects of the addiction. How much, as Mr. Edwin and Deepshikha rightly said, the screening needs to be done first. So after that screening, how much will the damage be once they stop with the addiction? Knowing that is important. Then again, early abstinence, as once you have made a commitment to continue treatment for your substance abuse problem, I guess this is the second stage where you know about that you should be stopping this, and early abstinence, stopping at an early age, is important again. So we should encourage the drug abusers to participate in healthy activities. Besides that, maintaining abstinence, and also, as I mentioned earlier, advanced recovery. After approximately maybe say 5 hours of abstinence or what, then you will really reach the fourth and the final stage, and that is advanced recovery, and then the person will definitely come out of it. Thank you so much. Over to you, Deepshikha.
Deepshikha, did you have
Thank you,
something to add?
Preeti. Now, yeah. I would like to say, just once one victim move from ahead, like he is now aware, now accepted, then the thing comes at prime is just he must be willingness, the degree of willingness in that person, how much he is strongly just determined about just leaving this very habit, you know that's very important. So if one person himself is not willing to leave this habit of addiction, then no one can help him or her. So there must be strong desire from deep within that person, so that treatment can favor in any way, or medication or counseling or any kind of behavior intervention can help only in that situation. Otherwise, nothing will work. So the very first step is just instilling hope as well willingness within that person, so that he can just strongly just determine to just, no, I need to leave this, because this very thing is harming myself as well, my family and my loved ones in certain ways. So I'm not going to just be with this habit for my life. These kind of
Yeah.
things should be there, so that that will help in just getting best out of treatment or any kind of interventions. That's
Thank
it.
you. And what are the initial steps in management of alcohol and drug abuse at the rehabilitation stage, Edwin?
Thank you, Katinda. The initial one, just like I mentioned, is the screening and assessment. Then we move with the treatment planning. When you're doing the treatment planning, you'll have already identified from the assessment whether this person is having a co-occurring disorder. And like I mentioned in the previous presentation, that the treatment stage, it should be handled concurrently. This person could be having some medical problems. Maybe he has fractures, broken limbs, and maybe he's having a broken tooth or something. The medical doctor should be involved. Then the psychiatrist should also be involved to do the assessment and know the degree of the damage to the brains. And then we need somebody to do the spiritual therapy, depending on the religious background. And then from there, we need the family members, the therapists, the significant other people in that who are concerned to the person. They need to be involved. So when you're doing the treatment planning, all these people should be engaged, such that when the treatment begins, this person can be treated holistically. Remember, we said after treatment planning, we will identify, will this person need detoxification? Will this person need to see a psychiatrist? Do we see some mental challenges? And from the history taking, you'll establish whether this person, there is a history of substance abuse. You'll know whether it is something that runs in the family, is because for sure we've mentioned here before that addiction to substances can be hereditary. So with the treatment planning, first and foremost, once the treatment planning is done, we try to stabilize this person so that he can be cognitive, his mental ability can can allow treatment to go through. This stabilization means before you start counseling, if this person is in physical pain, he cannot absorb treatment, the psychological treatment. You can be taking him through a session, and it could not be benefiting the person. So first things first, you first make sure the cognitive ability is back to normal. Then the physical, you begin with the physical, and then likewise concurrently you treat this person holistically. There are so many therapies that are involved, and I know we'll reach to that stage because I've just mentioned something about detoxification. We have the medical therapy, we call it the pharmacotherapy. All these are they are all involved in the treatment. Back to you, Katinda. Thank you.
Thank you. Thank you. Anyone wants to add anything more before we proceed?
Yeah, yes, as we started, just like the screening should is the first process to start with. So I would say a physician should actually spend some time to assess the addiction, the level of the addiction, and then a detox plan should be planned. So for the detox plan to be made, it is important to know, it is actually critical to know, and the patient, the drug abuser has to be honest with the physician. Secondly, the psychological assessment, as Mr. Edwin was also talking about. So in the psychological assessment, I guess the level of anxiety, depression, and bipolar or any other emotional or psychological needs the drug abuser is going through should be taken care of. And then the detox should be, detox is where the person is away from the drugs for a while, and then however there are top notch rehabs where A certain type of detoxes are experienced from varying the degree of the abuse happening on the patient. And then the last comes the therapy and physical fitness, and then various other things that happen at the rehab center. But then unless you don't go there, you don't accept, you don't admit, these things are not going to happen. So it all comes from you, from within.
Thank you.
Thank
Deepshikha?
you.
Just already Edwin as well, Preeti just talked about this all in very detail, very detailed. So only one thing from my side, that one need to just take care of, is there any disturbance in interpersonal relationship, or is there any such thing apart from taking just like those hereditary factors and all such things in account. Because usually what happens, one just just uh, I mean go towards these side, like addiction and all substance abuse and all such things, when there's some kind of disturbance or something missing in their interpersonal relationships in most of the cases. So for you can go through lots of research reports, they always just incident this, that yeah, this factor is there, so these things must be taken care of. And while just treatment planning, these things also needs to be included, that yeah, these sort of counselings or interventions needed to be given so that things may get better. That's it.
Thank you. So what about the reintegration back to the family or the community? How do we help them to do that?
Ms. Deepshikha, would you like to start first now?
Okay, so yeah, reintegration comes like it's kind of new birth for that victim. So they really need a lot of courage, a lot of moral support, and a lot of that emotional support system from their loved ones, friends, and family, as well. They are just a medical treatment and whoever doctor or psychiatrist is there with them, so that they can just face this new situation and new life with the full strength. Okay, and with the kind of high moral, so that they can move ahead and just live their life in best possible way, and just do well in all respects of their life regarding interpersonal relationships at workplace, at study, social aspect, and whatever not. Okay, just it includes everything. So basically they need a strong support system in every
Thank you.
possible way that really helps them to face the world again.
Thank
That's it.
you. Thank you. Preeti, do you want to add to that?
Thank you.
Yes, sure, sure. Thank you, Deepshikha. Most of the times, the patient feels that he will not be accepted by the family and by the society back, and then this holds the patient going towards the family. But then this is not the case. In fact, the family should reintegrate, so that giving some emotional support to the drug abuser, whereby they should have that strong confidence that they will be accepted by their family, and they should not be going in the post trauma stress. Otherwise they are coming out of something and again going back into stress. Again the cycle follows. They again start taking drugs because they are not accepted. So acceptance need to be come by both of them, by the drug abuser that he needs to stop this, and secondly from the family that they need to accept them for the during the recovery age. This is what that is it.
Thank you. Edwin, what do you have to add to that?
Thank you. It's very important for our communities, our family members to note that addiction is a disease. And just like any other disease, it has treatment. It has treatment facilities. We have hospitals for medical issues. We have mental centers for people with mental conditions. So there is a lot of stigma in our families. There is a lot of stigma in the society, and we are not ready to embrace these people once they've gone through the treatment. The very first stage that we should, or rather the very first step that we should take up is create awareness and let people know that addiction is a disease just like any other. Otherwise, if there is stigma, this person will feel disoriented, or rather he'll feel like he's not welcome in the family. Remember, even for the people we have in who are incarcerated, who are already in jails, a jail and a rehab is a rehab on its own. It's for rehabilitating, bringing back this person. But when these people come out of these rehabilitation centers, they are stigmatized, and if there is no support, just like Deepshikha is saying, if there is that no support from the external from the family members, from your, if it was your spouse, know that this is a changed person. Stop treating or addressing the person like he was in his previous life. Accepting that it is a disease is the very first step that we should emphasize on and create awareness. Like the forum that we are holding today, it should be spread over and out so that people get to know the information, and we'll have a changed community. Thank you, Katinda.
Yeah, I also believe that, I mean, educating, like you're saying, being aware, awareness is very important, and acceptance. But I think maybe there has to be programs out there to educate the whole community, because then this is something which affects a lot of households. You know, it's not like unique to anybody. It can happen to anyone. And the more information people have, the more they know how to deal with someone in the family who's got an addiction problem. Because I think, like you said about stigma, a lot of people just don't know how to deal with it. It's a stigma because of what they believe, their belief system, but then they don't actually know how to help the other person. Because like we're talking about it and we're just saying this is what you do, but they need to have a way to find the steps of how to deal with it in terms of themselves first. What do they need to do to be able to help the other person? Because sometimes they could also be struggling with their own issues, which means it's very difficult to see someone else's issue and try to help them as well.
Sure.
Yeah. So moving forward, what are the recommended scientific therapies in treatment and management of persons with addiction?
I guess, according to me, it should all start from behavioral counseling to be done regularly with the drug abusers. Secondly, medication should be given on a timely basis, and then medical devices and applications should be used to treat the withdrawal symptoms or maybe deliver some skills training, and then evaluation and treatment for the co-occurring mental health issues, because in such people, these kind of mental health issues always co-occur, like they have issues of depression and anxiety, so these should be taken care of. And lastly, there should always be long-term follow-up. It's not that the person has come out, so there should be no follow-up later after that, but then the follow-up should be a continuous process, a long-term, unless the person has permanently come out of it.
Thank you.
Thank
Thank you. Anyone wants to add to that?
Yeah, I think I'll take it up from there and mention that when we talk of therapies, what are the recommended scientific therapies? We are trying to address now the treatment. And I would want to mention at this juncture that treatment is not something that treatment does not follow a particular route. It differs from person to person. It differs. My approach to treatment, the way I'm responding to treatment, may differ from that other person. So the major ones, the key ones that we are following, that are the universal, the recommended ones. We have the medical therapy, the pharmacotherapy, whereby you find somebody. This is now where detoxification comes in. This is where now you have to put this person on painkillers to reduce the pain, the medicine used in treatment. But it's very important to mention that detoxification is not the whole treatment. It is just but a component of treatment. Then we have counseling or the behavioral therapy. We address how this person can change his lifestyle. It is recommended and it is scientifically proven that in most cases, you find people with substance use disorders, they have behavioral challenges. They have life skills which are, they don't have proper life skills with them, so we instill them. Then we have the family therapy. We need to talk to these people, the parents, we need to talk to the spouse and the children of the affected person. The family therapy is very key because, like I said, initially the problem of addiction originates from our families and our societies, because this person saw it somewhere else. Little did he know that he has genetic problem with the substance. So it is very important, it's very key to involve the family. Let them be aware that this is a transformed person. Then finally, we have the therapeutic communities. How do we involve the communities around so that they accept how, just like you mentioned, we need outreach programs to educate and create awareness to the public such that these people are not stigmatized again, so that once they start the recovery, their support system is well placed. So these are some of the therapies, and they are very key. And pharmacotherapy, the ones that we use chemicals, we use medicine to treat, should not be taken to be the final. Detoxification is not the final treatment. It's a collective. Treatment in addiction has a holistic approach to it. Thank you, Katinda.
Thank you. So, Deep, did you want to add on to that?
Yeah, already both of them have just spoken so much about that thing. Still, I would say, yeah, the very first thing is psychoeducation. And then when it comes to just scientific therapies or whatever it is, so yeah, definitely there are behavior interventions and then medication, detoxification, lots of things are there, which varies and depends from person to person. As well, their individual needs and medical conditions and lots of things are there in this backdrop. So one need to take care of that. And most important thing is just instilling hope and that strength. Yeah, you need to just, you can overcome this. And it's completely treatable. There's no doubt in that. One thing which is very important is the willingness of the person to just get well and get
Sure.
out of this. So that's something very important. And only then any sort of treatment or any sort of intervention is going to work. So that's something very important as well. Group therapies really work well because in group, if you are just providing therapies in group or some group sessions are there, that can include families as well just victims. So that will help them. They just will get to know that yeah, other people are also like us there, and that will just give them moral support, and
Sure.
they can strongly come out of that. They won't feel that isolated kind of thing. That's the thing.
Thank you. Now,
Thank you.
Edwin, you did talk about detoxification. So, what exactly is detoxification? Can you please tell us?
Thank you, Katinda. Detoxification is just, but it is actually a medical intervention that manages an individual safely through the process of withdrawal, acute withdrawal. Actually, it's a medical intervention. This therapy, detoxification therapy, is a form of harm reduction. Harm reduction in the sense, could be this person is having some complications with the liver. This person could be having problems with severe headache. And once when you are doing the screening, you identified, and in the screening, it's also very important to do drug testing. You do drug testing to identify whether this person could be, he's presenting only two drugs of choice, probably cigarettes, tobacco, and alcohol. But if you do the drug test, you'll identify that there are elements of marijuana in it. These drugs, the multiple drug use, they need different detoxification methods because each has its different way of integration or interaction in the body with the body, the drug interaction factor. So in the detoxification program, what we normally do, we try to remove the toxins. Detox, actually it's derived from two words, detoxins, removing the toxins in the body. And we have it's very good to mention here that we have two approaches to that. You can do natural detoxification and the medicine, rather the pharmacotherapy approach to it, whereby we use drugs to make you urinate, to make you pass urine, we make you sweat, we make you so that these toxins can leave the body. On the other hand, there are those natural approaches to detoxification because all we need is these toxins, these bad elements in the body to come out. Detoxification is a component in a treatment, and it helps. Actually, it helps in so many challenges. You may have a client who is convulsing. You have a client who is undergoing hallucinations, auditory and visual, and you need this person to be detoxified so that he can calm down, so that the other therapies can flow in very well. Lastly, detoxification has three components. Component number one is the evaluation stage, whereby you do the screening and assessment and you know the amount of drugs or the prevailing mental condition or the prevailing medical condition. screening. Number two is to stabilize this person in detoxification. You give them, you inject them, and you take them through physical exercises. Finally, the treatment bit of it. So detoxification is just but a harm reduction therapy, pain and associated things to it. And it is not the only treatment, because we are looking even at the mental wellness. Once the toxins are out, then stability, the cognitive ability has been restored, then the counseling sessions and the group therapies now take over. Thank you, Katinda.
Wow, that was very informative. Anyone else has anything else to add to that?
Yes, right, Mr. Edwin. As you said, that detox cannot be taken permanently. Detox is actually to be taken for a short period of time. You rightly said this is actually to facilitate the withdrawal of the toxins from the body and to give complete freedom from mood altering drugs that the patient has been taking for all this time. Most of the time, the victims also fear to go through detoxification because they are not aware of this process that is going to happen with them. They have experienced drugs, they have taken the pleasure of that, so they are not willing to go through the pain of detoxification. This should be definitely taken into consideration for a short period of time. Once the patient is free, then other therapies can come into. Thank you, Katinda.
Thank you. Deepshikha, did you have anything quickly to add?
Yeah, I just loved Edwin's that advice that there is natural way to detoxify, and that's something awesome, really awesome. And what I would like to say that yeah, there are side effects. If you are doing it medically, then there are side effects. That also varies from person to person. So it's always the best thing to just go with naturalistic things. And if there's a need that's important, then definitely one should go for medicated detoxification. Otherwise, it's always the best thing one can do is just to go for natural way, because that's not going to harm you at least, and there's no side effect with that. Apart from that, I would say guided meditation and yoga kind of practices really help in just coping up from craving thing, because that craving thing is there until and unless one just overcome this habit completely. So that really helps a lot, because that stay just helps us stay focused and motivated for staying out of such kind of habits. So guided meditation really helps. That's also a kind of natural detoxification, I would say. That's from my
Thank you.
side. Thank you, Katinda.
Thank you. So before we conclude, I know there's so many ways to protect and manage your mental health and well-being. What is one thing you do for yourself on a daily basis to check in with your mental health? Preeti.
Yeah, meditation is the best way that I do for a mental health, and then rising up early every day is the best thing. I love to rise up before the sun rises, so that is the best practice that I follow. And doing my meditation, my daily chores, spending time with myself is the best practice to be followed. In introspection, or there are many things. Just be with yourself and just be. Don't fake it to make it. You have to be yourself.
Yes, thank you. Deepshikha, what about you? What is one thing you do every day to check in with your mental health and well-being?
I would also go with just yoga, meditation, and just have my time. That's something best. And yeah, of course, just pursuing some hobbies. That really helps.
Wow, thank you.
And obviously, yeah, giving my bit to this world as I'm doing with Jimha. That's something best.
Thank
you. Edwin, what about you?
Thank you, Katinda. Like I always say, I like sharing a lot. I like conversing. I like sharing with people who are vulnerable. This helps me to share. It actually, I find it very therapeutic for me, because there is nothing that is piling up. But this is New Year. We have New Year resolutions, and one of the New Year resolutions is to start the physical exercising, to do the meditation. And I believe with the help of Preeti and Deepshikha, they'll take me through the classes, and I'll be good to go for the rest of the day. Thank you, Katinda.
Thank you.
Katinda, we would also like to know your practices that you follow every day. We would also like to hear from you.
Well, me, I've got a routine that no matter what happens, I have to do. So when I wake up in the morning, the first thing I do is obviously use the bathroom, drink some room temperature water, meditate for 20 minutes, And then I also exercise. I do physical exercise for 20 minutes. And then after that, I do my gratitude journal. I always write what I'm grateful for on a daily basis. And every time I remember, I say thank you because we're alive, we're here. It's just a gratitude everywhere. And I believe gratitude is so amazing. It helps a lot of people heal as well. Just saying thank you to just you being you. Thank you for having eyes. Thank you for having your nose. Thank you for having your ears. Just thank you for the body you have, which has got all this amazing computer system that makes us be who we are. So that's my daily routine about gratitude is my biggest one. Now, before we go, I see we've got a question or a comment. Where the client is willing but lacks the resources to consult a mental health expert, as their services most times are not free, plus the scarcity. This is, for example, in Nigeria. What can an addict do? The steps being discussed here are practical and needs a professional to check up on an addict. So if somebody doesn't have money, how can they get help?
Oh, wow, thank you very much, Katinda. Here in Kenya, we have those who offer pro bono services. We have people who like I normally call on people who have issues but they cannot raise funds. I always do those kind of jobs. They are humanitarian. I mean, if you come across somebody who is in dire need of services, when you know for sure this person does not have the capacity, I mean, you could help one person and change the entire community. All right. So I would encourage us to, as professionals, not always to be on the money making end. Let's try to be a humanitarian. Let's have that aspect. That is number one. Number two, we have leaders in different aspects. We have religious leaders. You can go talk to your pastor. You can go talk to the person who takes you through the. There is help. I believe there is a way that one can get help. Lastly, recovery or rather treatment or anything to do is in acquiring information, acquiring knowledge. You can gather information. If, say, for example, your brother is having problems with alcohol, you as a significant person to that brother of yours, get more information. Some things are very practical. You can do them at home. Like just I mentioned, the detoxification. You just need a skipping rope, just like you mentioned, Katinda. You just need some physical exercises. You drink plenty of water. This will induce urination and you'll have detoxified. Once you exercise, you sweat, you detoxify. Once you reduce the levels of intake of alcohol or your drug of choice, it's very therapeutic for you. So once these are failed, that's now when you come to seek what you can do for the betterment of your health. Now that you are aware that it is a disease and it's something that you can prevent. So I would urge all of us, the professionals, wherever you are, take up, be the change that you want to see in the community. Initiate something, do something for the community, and blessings will shower upon you. Thank you, Katinda.
Thank you. Does anyone else have anything else to add? Deep or Preeti?
Yeah. Just the law of attraction works really great. So I would say the more you give, the more you get. That must be the policy. So be giving. That's it. That's it. Over to
Yeah, I
Preeti.
would like to say those certain things are, of course, certain treatments are not free, but then there are definitely free drug rehab centers. And besides that, having a positive outlook is free. Taking a positive, healthy lifestyle is free. You just need to add some sports to your life, pursue some hobbies in your life, and those all are free. Just sit with yourself and introspect. What should you be doing to come out of this? Have a strong mindset, and all these things are free. You just need to sit with yourself and focus on your thought process.
Yes, I think also if you have a good support system, because I think most people probably, apart from the stigma, is the fear of being judged. When you're afraid, what is somebody going to say about your addiction? What they're going to blame you, they're going to find fault with you. And that is a big fear for a lot of people who have any sort of problem in the world, not only addiction, just life in general. And if people can get past that part of worried about what other people think and just seek for help no matter what, because if you seek for help, what is somebody going to do? They're going to talk about you. Well, at least you're doing something. You're doing the first step, asking for help, because I think that is very crucial. Now, where can people go to find information about the Global Youth Mental Health Awareness?
Thank you very much. for Global Youth Mental Health Awareness, GYMHA. We can always search for Global Youth Mental Health Awareness on LinkedIn, and also on Facebook. You just search for Global Youth Mental Health Awareness, or in short, the abbreviation is GYMHA. Even on YouTube, you'll find us there, or else you can search or you can log into www.globalmentalhealthawareness.org. I mean www.globalmentalhealthawareness.org, and you'll find more information, and we are always there ready to assist you.
Thank you. And where can everybody find you as well? So, Edwin, what is your social media or your website? Where can people find you?
Thank you, Katinda. On my social media, I'm on Facebook, and I'm also on LinkedIn. On both Facebook and LinkedIn, you just search for Kibe Edwin Gitau. As it is appearing on the screen, Kibe Edwin Gitau. You'll find me on Facebook and LinkedIn, or else you do me an email, gitaukibe@gmail.com, GITAUKIBE@gmail.com. And I also have a website, www.uhaicenter.org, www.uhaicenter.org, uhaicenter.org. Thank you very much, Katinda.
Thank you. What about Preeti? Where can people find you?
I am on LinkedIn with the same name, Preeti Pasricha, and on Facebook as well. So I am just a message away. You can message me on LinkedIn anytime. I will definitely revert.
Thank you. Thank you. Deepshikha, what about yourself? How can people find you?
Just type my name and you will get me on LinkedIn as well on Facebook. And as for Insta, it's Deepshikha8736. That's
Thank
it.
you. Thank you. Thank you.
Thank you, Katinda.
So thank you, Edwin. Thank you, Deepshikha. Thank you, Preeti, for sharing your insights and shining the light on addiction once again, and for sharing the tools and strategies to empower families and communities to thrive and become better than good. Thank you, viewers, for being fabulous audience and for watching the Global Youth Mental Health Awareness Show. Now, next week's topic we've got some great news, and the news is we've got a program called Let's Sort This Out Together. It's an SMS application project, which will be looking for 10 young people, 10 young champions to join the program and to be able to get support, to get encouraged, to be the role models of what it looks like when you've got a good support system to help you with your mental health and well-being. So until next time, take care and stay blessed. Bye for now.
Thank you,
Bye-bye.
Katinda. Bye-bye, Edwin. Bye-bye, Deepshikha.
Bye-bye.
Bye-bye.
Bye-bye. Bye.